Nursing intervention for patient safety in nebulization procedure. 1. Follow 6 rights and 3 checking. 6 rights. Right patient, right drug, right dose, right route, right time, and right documentation. 3 checking. When taking medication from the medication cupboard. Second checking. During preparing medication. Third checking. Before returning to its storage place. 2. Before the procedure, check emergency trolley, especially oxygen and sucker machine. Check nebulization machine. Check electrical supply. Number 3. Assess the patient respiratory status before, during, and after procedure. Observe the patient for complication, palpation, headache, nausea, tremors. Thank you.